Well, $1 million smile, and I'm looking at one over here. It's a phrase that's taken on new and a lot more real meaning as more people are being drawn to the dental chair, not to get a tooth filled, but to alter their appearance. Dentist Dr. Alan Malouf has been practicing in San Francisco for almost 20 years, and he says in that time, requests for cosmetic work have jumped from about 10 to more than 50%. Well, he joins us now to talk about this change and the new cosmetic choices that are currently available to his patients and to everybody, actually. Welcome.
That's right. Thank
Hi.
you. Hi.
Now, any dentist can do this. You were talking before the show and said that people don't need a special cosmetic dentistry license. There isn't such a thing.
There really isn't such a thing. In fact, it's not a recognized specialty by the American Dental Association. Basically, cosmetic dentistry can be performed by any general dentist who has interest in it and attends courses in cosmetic dentistry.
And what is cosmetic dentistry?
Well, Laurel, cosmetic dentistry really refers to any dentistry that's specifically designed to improve the aesthetics or the appearance of a smile.
And it's very popular right now. Is it because everybody suddenly realizes they can do this after years of living with, what, yellow teeth and cracked teeth?
And as more and more people realize the importance of the smile to their overall appearance, more and more people are asking for cosmetic dentistry.
What are the three most popular choices right now?
Well, without a doubt, bleaching is the most popular procedure right now, as well as composite resin fillings and porcelain veneers.
Okay, let's go into those a little bit. Let's take the fillings, for instance. You know, in other words, people that had the old-fashioned silver fillings want those covered over?
No, those are removed and replaced with a composite resin filling.
Okay,
and I think we have a picture
can see right
of that.
Here the before. All right, so this is just to hide the silver in the mouth. Or I mean, take it out and
to replace the silver.
Replace it.
That's correct.
Do you get to keep the silver?
No,
Okay,
not really.
I just thought I would ask. Okay, but again, this is for people who just don't want to open their mouth. Even the teeth in the back?
That's right. It's interesting. You know, people with teeth that have silver fillings way in the back still seem to want tooth-colored or white fillings. Just because they're concerned about the cosmetics when they themselves look in their mouths.
Right,
yeah,
okay.
It's interesting.
All right, well, let's go on to bleaching now. Now, how much does that cost?
Bleaching generally runs $400 to $500.
Okay, and let's see the pictures on this because that can be very dramatic with the before and the after.
And that actually is a case of a porcelain veneer.
A porcelain, this is a porcelain veneer,
Right,
excuse me, not the bleaching. Okay, right, and the reason, let's talk about this because the porcelain veneer fills in things.
That's right. This young patient in his 30s is a stockbroker in a high-stress occupation. He grinds his teeth a lot, and his teeth are shortened. It makes his smile look older.
Okay.
And by veneering the teeth, we have a more youthful, attractive smile.
All right, and that costs?
About $600 to $800 per tooth.
Okay, and here's another one you can see with the chip tooth, $600 to $800. So in other words, you're really going to, want this a lot.
Right.
To be able to afford it.
Right.
But what a difference.
It looks great. The results are really spectacular. This is a patient that chipped his tooth, and we veneered that one tooth.
Okay, now with the bleaching, I know that this little gizmo is what people can wear.
That's the bleaching splint.
This is the splint,
right.
and it just fits over the teeth like this?
That's right.
I don't want to do that here, but okay. And then...
It won't fit you.
No, that's true. So you take the mold.
Exactly. The impressions are taken at the dentist's office from which bleaching splints are made.
Okay, and the results, well, here's the mold right here.
That's the mold.
And how much is what is this, about a 3-week process or a few months?
You know, it depends on the patient. It can be anywhere from a few days to several weeks to months. Essentially, the patient uses the bleaching splint at home, places the hydrogen peroxide in the splint, and wears it for anywhere from a few hours to overnight.
Right, and does not end up with the blue teeth, of course.
No, that's
that was the mold.
Part of the model,
okay,
right.
And again, the bleaching costs?
$400 to $500.
Okay, so you're talking somebody who would really be ready to spend the money and to want this done cosmetically for good reasons. Okay, thank you very, very much.
And the other type of bleaching is laser bleaching.
Oh, that's right, which is even more.
About the same.
Oh.
It's done at the dentist's office with a laser light.
Okay, fine. So there's lots of choices for people these days, which is really, really good.
That's right.
Okay, for more information, and thank you very much,
Thank you.
Doctor, you can contact Dr. Malouf at 415-398-0411 or call the San Francisco Dental Society at 415-928-7337 or, of course, your local dental